Hello, I am Noreen, your nurse for today. So for today, I will be assessing my breast. It is necessary to have an assessment or an examination of the breast to detect for any masses present in our breast. And having an assessment of the breast is one of the things to do to increase our chances of preventing or surviving from breast cancer. So, for this assessment, I will be using centimeter ruler. But before I start, I will first perform hand hygiene for infection prevention. And close the door for my privacy. So now, I will be asking myself some questions. If I have any history of the following questions, I will be asking. So I will now start asking some questions. Have you experienced having breast masses? And if yes, what was done about them? Have you experienced any pain or tenderness? How about when you have menstruation? Do you feel any pain or tenderness in your breast? Have you had any discharge from your nipple? Have you experienced estrogen replacement therapy? Does any of your family members, like your mother, sisters if you have, or aunt have breast cancer? Do you drink alcohol? Are you on a high-fat diet? What is your weight? Do you use oral contraceptives? Do you do breast self-examination? How about when you have menstrual cycle? Do you do breast self-examination? And what techniques are you using? Or what techniques do you use when performing it? Okay, so now I will begin the assessment. I will now inspect my breast for symmetry and contour or shape while I'm in a sitting position. I am now starting to inspect, and I can see that the shape is rounded. It is slightly unequal in size and generally symmetric. Now, I'm going to inspect the skin of my breast for localized discolorations or hyperpigmentations, retraction or dimpling, localized hypervascular areas, swelling or edema. I am now starting to inspect, and I can see that the skin of my breast is uniform in color, similar to the skin of my abdomen. I can also see that my skin is smooth and intact, having a diffuse symmetric horizontal and vertical vascular pattern. I didn't see any abnormal deviations like localized discolorations or hyperpigmentation. I don't see any retraction or dimpling, which is a result of scar tissue or an invasive tumor. I don't see any unilateral localized hypervascular areas, no swelling or edema appearing as pig skin or orange peel due to exaggeration of the pores. And to emphasize any retraction, I will raise both of my arms above my head like this, or I will push my hands together with my elbows flexed like this, or I will press my hands down on my chest like this, and I didn't see any retraction. So now I'm going to inspect my areola for size, shape, symmetry, color, surface characteristics, and for masses and lesions. I am now starting to inspect, and I can see that it is round and bilaterally the same. Now, I'm going to inspect my areola for size, shape, symmetry, color, surface characteristics, and for any masses or lesions. I am now starting to inspect, and I can see that it is round and bilaterally the same. The color varies widely from light pink to dark brown, having an irregular placement of sebaceous glands on the surface of my areola. For any abnormal deviations, I will see asymmetry, masses, or lesions. Now I'm going to inspect my nipples for size, shape, position, color, discharge, and lesions. I am now starting to inspect, and I can see that it is round, everted, and equal in size. It is similar in color. It is soft and smooth, and are both pointing in the same direction. I can see that there is no discharge present and no inversion on one or both nipples. I don't see any abnormal deviations, like any discharge, crust, or cracks. And if I were to see any discharge, I will observe for the color and the consistency of the discharge. So now, I'm going to palpate my axillary supraclavicular lymph nodes while I am in a sitting position with my arms abducted and supported on the nurse's forearm, like this. So I will now palpate the four areas of my axillary, the edge of my greater pectoral muscle, which is here, the thoracic wall in my mid-axillary area, which is here, the upper part of my humerus, which is here, and my anterior edge of my latissimus dorsi, which is here. So I can see that there is no masses or tenderness present. And for abnormal deviations, I can see any masses or tenderness present. So now, I'm going to palpate my breast for masses or tenderness or discharge of my nipples present. So I'm going to use the 3 techniques, starting with the hands of the clock. This is how to do it. And this is the second technique, which is the concentric. this is the third technique, which is the vertical strip. So I can see that there is no masses or tenderness present. And for abnormal deviations, I will see the presence of masses or tenderness. And now, I am going to palpate my areola and nipples for discharge. I will now compress each of my nipples to identify any presence of discharge, and if I were to see any presence of discharge, I will milk the breast along its radius to identify the discharge producing lobe for an amount, color, consistency, and odor. And after doing that, I will note any tenderness on palpation. And after doing all the procedures necessary for this assessment, I am document all the findings in my record.